When we first came across this as a student, the horror amongst our group was that this poor dog's been neglected.
Yeah.
How long would this have been? And the reality is, having had a dog that suffered from hot spots, the dermatitis, it just happens within minutes.
Yeah.
You can't explain unless your pet has experienced it, just how
Yeah.
quickly they can traumatize that area. Welcome back to the Pause and Effect podcast. I'm your host, Dr Carra, a dedicated veterinarian here to dispel all the myths that you need to know about. I've got Dr Nic back. You know that we've had several conversations.
We have.
Welcome.
Thank you.
We have discussed raw food diets. We've been stuck in a hot car, sweating it out in the heat, just to explain and discuss the impact of our dogs overheating. We've done dental disease. And I know historically I've spoken a little bit about skin issues, in particular itchy skin, but I have never had a conversation about it with a colleague. And, you know, I know your love for nutrition, your love for educating, and you were definitely the best person to talk to about this.
You.
So welcome
Thank
back.
You. Thank you for having me back again. Yeah.
So I suppose a good place to start is, why is my dog or cat scratching?
Sure.
Let's just do opening one. Like, why?
Yeah. See, so this is like a Pandora's box of things. So I think just to set everything straight right from the beginning is that skin cases can often be very, very frustrating, not only for the poor little pet who's scratching themselves silly, for the pet owner, and for us as vets as well.
Yes.
So it is a combination of working together that we can then potentially get to the bottom of the situation. Unfortunately, there are some skin conditions that can't be cured, but they can certainly be managed. And I think we'll dive into those a little bit later on. So very broadly speaking, there's three major categories that most of the skin conditions can potentially be lumped into. So the first one that's potentially going to cause itching is parasites. So that's ticks, fleas, sometimes even worms. So internal and external parasites can cause itchiness and irritation. Allergies, which are probably the most common, and that's environmental, contact allergies, etc. And then also food, proteins, carbohydrates, the likes of that. So that's where the nutrition thing comes in, that animals can have allergic reactions to food or certain components of food then as well. So very broadly, we can break various skin conditions up into those three.
As the most common.
Common, yeah. So you often will get overlapping potentially of some of the circumstances that the dog or the cat will find themselves in. And that's where almost like the investigation has to then really get in depth. And it can be quite frustrating, like I say, for the pet owner, and for us. At my practice, it's a minimum of 30 minutes for a consult, if not longer, because there's lots of questions that need to be asked, a lot of background, a lot of history. It's not always
Quick
that's
fix.
Exactly what it is. Off you go.
So before we go into all of that, I thought maybe a good point to start would be the difference between having that acute puppy that maybe has been stung by a bee, we don't often know why, and they come in and they're scratching and they're going crazy, and maybe we can talk about that versus, like you're saying, something we can refer to as chronic. It needs a workup, it needs management strategies, and it needs very much a great communication and effort by all parties involved in order to try and manage it better.
Yeah.
So that young puppy, it comes in and they're full of bumps. I'm sure a lot of the listeners listening will have had experienced this with their pets, or the cat, and suddenly the hairs are standing on their head. What's happening there?
So that's generally an allergic reaction from either, and the most common thing, particularly with puppies, is bee stings or a wasp or something like that. And then as humans will have an allergic reaction to something like that, so will the little puppies and kittens. Kittens not so much. I can't actually say that I've really seen
more local.
many. It does tend to be the little pups. And often they look like they've been punched in the face because their little eyes are all swollen, their lips are all thick, and they're all like leathery almost. But I have to say, in my experience, there's never been one that's really gone into anaphylaxis. So that's a very serious allergic reaction where you get the closing of the airways, et cetera, et cetera. So that's a very, very serious one. But yes, as you described, the bumps on the skin. So even if you look at them, a short-coated dog will just have these undulations and these little lumps of varying sizes, possibly a little puffy, swollen face. So that's a very, very quick, acute allergic reaction. Very easy to treat and sort out.
And they're itchy, aren't they? I mean, they're scratching, they're really uncomfortable,
rubbing their faces, so a shame. They don't really know what to do with themselves. And unfortunately, they don't generally learn their lesson either. No. So it can be one of multiple times that they'll then have a little vendetta against the bees flying in the lavender bushes, and they'll go and get it again, and same thing again. So, that's a very quick, simple,
straightforward thing to manage. And that's mostly histamine release, the itchy. You're managing it, trying to manage the inflammatory response.
Yeah. So that's where. So we will be talking about certain medications. So I think everybody knows about cortisone. So cortisone, as far as I'm concerned, it does still have its place. But when we get away from the acute things to the more chronic, that's when we will discuss in the other options that we have available to us. So short-term use of cortisone just to stop that itching, get that skin back down to how it's supposed to be, just tell that immune system just to chill out, it's really not that bad. A quick injection, either of an antihistamine, a cortisone, or both, and then just a few tablets to carry on with for the next couple of days just to make sure it doesn't potentially flare up again. And obviously if you find a little sting in the little lips or something like that, then you can remove it. They don't tend to be as sensitive, I don't think, pain-wise, because if anyone's been stung by a bee, you know exactly what it's all about. And then you get that painful throbbing and then that itching. The cortisone will definitely just settle all of that down, get everything back to normal again. So that's an acute, very easily treated skin itchy, irritated condition that we can sort out. And then, as you've alluded to, we get then the more chronic ones. So that's shame. The little Jack Russells that just scratch and scratch and scratch. The little Maltesers.
So these are the breed predispositions. So
potentially, So I mean, it does tend to be. Well, I've just found that more so for general itchiness, pruritus, that the little short-haired dogs tend to be more representative of the cases that we see for that. So the little Jack Russells, even little Yorkies, little Maltesers, anything that's got a fairly low little chassis to the ground and they can come into contact with grasses and plants more easily, for example. They don't have a nice thick hair coat because the hair coat does actually form a very good physical barrier to the pollens, the plant fibers, little grass hairs and the likes of that getting physically onto the skin. So, we do tend to find, well, at least the ones that I've dealt with, it tends to be not always, but tends to be the shorter coated dogs that will have more of a contact dermatitis and allergy as opposed to longer haired dogs, which don't, they still can, but I think are less representative in that group.
Yeah. Welcome back to Just for Pets. You're with Dr. Carra.
Hello, Doctor. It's Chanel the Persian. And, I can't seem to stop retching to get this hairball up.
Are you on a special diet?
Excuse me?
Hairball control food will really help. And maybe some Laxapet. And lucky for you, Just for Pets have a big range.
Well, how early can I get some?
Order today and we'll deliver pronto.
Wow! I feel better already.
Justforpets.co.za. Vet approved, pet adored. Get it all to your door.
Before we resume our conversation, let's address a vital aspect to pet care, your puppy's nutrition. Allow me to introduce you to a personal favorite, Ultra Pet's premium recipe for large breed puppies. I've relied on this for all my dogs and it's truly made a difference. This puppy food offers a balanced blend of nutrients, 30% protein, 15% fat, and 4% fiber, supporting your companion's growth and development. Featuring a delectable chicken and rice flavor, Ultra Pet caters for even the pickiest eaters. It's available in 2 pack sizes, a 8 kg and a 20 kg, and it's suitable for households of any size. What sets this puppy food apart is its meticulous formulation, developed by experts for a complete and balanced diet. It includes essential vitamins and minerals and prebiotics for a healthy digestive system and a robust immune system. With high-quality protein sources and essential fatty acids, this food promotes muscle development, healthy skin and coat. Plus calcium and phosphorus strengthen bones and teeth.
Ultra Pet has mastered the balance between nutrition and taste, making it a top choice for puppy food. Find it at your local pet store and give it to your companion for the best start. Your pet will thank you, and you'll appreciate Ultra Pet's commitment to optimal nutrition. Now, let's get back to our conversation.
So before we tackle the chronic skin issues, I want to take the opportunity before we lose it to talk about the long-coated dogs and discuss one of the things we do see in these dogs, which is often ear-related,
yes,
and the hot spots.
and the hot
So those
spots.
two conditions, can we explain to the listeners why they are? I mean, it just doesn't seem relevant to the discussion we're having here, especially ear.
Yes, yeah.
But why is it that we're bringing this up at this point?
So the actual lining of the ear canal is classified as being skin. So it's not the same as the lining of your mouth or your nose or around your eyes. It is classified as being skin. So if your skin in general is irritated, inflamed, itchy, there is a very high probability that you could potentially get ear infections associated with that as well, either directly from the inflammation or then the microenvironment inside that ear canal is manipulated negatively. So there are normal organisms which are supposed to be there, the commensals that are in there, the same as everybody has got a bacterial population on their skin, so the same as for our dogs and our cats, and it also then extends into the ears. We find that with the skin conditions, water getting into the ears is usually the most common cause. So if your dogs are swimming, if they're playing in the sprinklers, if they're playing with the hose pipe while you're washing your car, for example, and they get water in, but it doesn't then dry out, that manipulates the inner environment inside that ear. So then either the yeast, so if your dog has ever had one, they might refer to it as, well, it is malassezia. So in that particular form is classified as being a yeast, and then you get the bacteria, which can then be broken down into the cones and the cocci and the rods. One or the other will generally then get a little bit more of a foothold with the changing of that microenvironment and then start growing out of control, because they will tend to actually compete with each other for space, resources, nutrients, and in that so naturally keep their numbers down that are not causing any sort of disease or itchiness or irritation. But if one or the other starts growing out of control, that's when you start then might get a little head tilt, or the one little ear might hang a little bit lower, or then you get that incessant scratching or flapping of the head.
Or the smell.
The smell is quite classic as well, yes. So coming in, you'll often see this poor little head tilted to the side.
Or even the hematoma that forms from that
as well,
head
So that's in the trauma of the ear hitting the top of the head and the side of the face.
Sure.
So also if they're doing excessive scratching, and then again, particularly in the more so in the retrievers, Labradors, German Shepherds, Rottweilers, they tend to have quite a thick fur around their necks and their ears. With that consistent scratching, they are also then forming little micro fissures in the skin. And because the hair is thick and there's possibly a bit of dampness there, the hair mats together and you get this horrible, horrible moist dermatitis underneath all of that. And that grows literally exponentially. So
I mean, I've got to be honest here and stop you. When we first came across this as a student, the horror amongst our group was that this poor dog's been neglected.
Yeah.
How long would this have been? And the reality is, having had a dog that suffered from hot spots, the dermatitis, it just happens within minutes. You can't explain unless your pet has experienced it, just how quickly they can traumatize that area.
So when the clients do come in with their dog and say that this wasn't here yesterday with a hot spot, it probably wasn't.
We believe them.
So, and also once it's actually shaved and clipped and cleaned up, because obviously you want to try and get as much air onto it, because that immediately is almost like an exponential healing process then as well. As once you've then cleared that matted hair, you get air movement, it stays dry, and then obviously you can get an ointment in that particular area where they can't then lick it off. You'll be able to do something like that. But they can, and often the owners are very, very shocked as to how big, because you might see a little area about yay big that's red, inflamed, gooey, oozy, horrible.
And it's a combination, don't you find often that they're really itchy, but it's sore.
It can be incredibly painful. Sometimes the dogs are sedated. So if we'll generally try first, so we'll clean it with some cool water and the disinfectants that we then use. And if they're tolerating that, then we'll attempt to clip it. But yeah, there are times where it is just far too uncomfortable, and it'll generally be 3, if not 4 times the actual size from what you can physically see once you've then clipped that area.
How horrified are your
I
clients
know,
when they go home with this big clipped area?
It's just fur, it's going to grow back again.
It's going to grow, yeah.
So that's almost where you get that correlation between then the ear infections and then potential hotspots. And they'll tend to, because they're scratching around the ears, they will then tend to form on the side of the neck or at the base of the ear. Yeah, and they can often, so you just imagine those ears are really painful and uncomfortable already, and then you get now this horrible moist dermatitis as well. So yeah, it's not a nice thing.
No.
Having said that, though, again, those are not necessarily chronic issues.
Yeah.
So with the hotspot, once it's clipped and cleaned and you've got a nice a topical treatment, sometimes they do require systemic antibiotics as well if it is really, really bad. And the same with the ear infection, so that's the otitis. It'll generally be otitis externa, which means at the outer part of the external ear canal that's affected. An ear smear looked under the microscope, you'll be able to then identify if it's the 2 types of bacteria or the malassezia, and then treat appropriately as well. So those are generally also, it's not like the bee sting where you give them their cortisone injection, for example, and by the end of that afternoon they're already comfortable. It is a process to, maybe it's like about a week or so to get that under control.
But not long term. They may be prone to it.
Yes.
Because it could be
where
indicating.
the skin, so that's ultimately when the chronic skin comes in, which can then link in with the ear infections as well.
So let's go there. Chronic skin issues.
So thankfully, well, when I say thankfully, usually we get to the diagnosis of being a contact dermatitis. I can maybe count on one hand over 17 years of being in private practice as to how many food specifically or nutritional related reactions there have been. So it's really not a common thing. We do tend to be more the contact dermatitis, the allergies, so that's inhaling pollens. When I talk about the contact dermatitis, that's then the grasses, the plants and stuff like that.
Even in the house,
Even
house
in the
dust
house,
mites.
100%.
People don't realize, they always think it's outside.
No,
but
it can be
it's not that
inside
their house
as well.
is dirty.
No. Like,
It's
again,
just they're reacting
almost
to
like
something.
normal commensals that you have in your house as well. They are going to be there. And some dogs and cats will just be more susceptible and more allergic to them than others just will not have a reaction at all.
So can people compare this if we want to start, just so that they can take themselves on the journey if they don't have a pet at this stage that has had skin issues, although I think most people can relate to this, of it being like trying to manage hay fever or eczema or the kind of skin issues that we have as
So I think those are 2 really good examples because it can be seasonal. So the hay fever generally during when the pollen count is higher. Also humidity can set off an eczema, for example. So weather conditions can certainly and seasons can certainly play a part in it. Here where we are, we haven't really had a cold winter at all. So usually it does get a little bit cooler, and that usually then decimates the tick and the flea populations, drops the humidity. Obviously there's not the pollens and the likes of that, so we tend to find in winter months in our province that the skins do settle down a little bit. But certainly this year it hasn't slowed down. We've still been getting the same number of ear infections coming through, and the general itchiness as well. So there's a number of factors and that's why, again, it can be very frustrating to try and get to the bottom of what's causing that particular issue.
So let's talk a case. I get a dog, I'm bringing it to you. I just can't cope anymore with this itching.
It's keeping you awake at night. You get the licking and the scratching.
I think that is what most people can relate to, is that irritation of the distress. Your pet is under, but also just there's something about that licking or head shaking, whatever, that was really quite frustrating.
Well, for you and for the poor
all
little
concerned.
dog or cat.
So how do you approach it? From my perspective, I've always, or perhaps I was taught this way, that it's slightly about talking about a threshold that they can be pushed over that can come from different components. What is your approach in terms of trying to explain to people both the origin and then the management thereof? So how do you approach these cases?
So I think one of the first things I will discuss with the client, we'll obviously get a full history. As we've already mentioned, we make sure that the tick and flea and the deworming and everything else, that is all up to date. Mites, I find nowadays, are incredibly rare because any of the new generations of the tick and flea preparations, be it a spot-on or a tablet form or with the collars, they do deal with the mites as well. So I think mites nowadays is a very, very, I mean, they're still possible, but it's really not a right up there to look at. But you need to get an answer as to what could potentially be causing this, and that's where the workup then comes in. So that's before I've even necessarily looked at the dog. Sometimes you can smell the dog as it walks into the reception area, poor thing, because they've just got such a horrendous.
So where does the smell come from?
Secondary bacterial infection.
Okay.
So the skin itself is a beautiful protection mechanism.
Yeah.
So it keeps things out and it keeps things in. So with an inflamed, itchy, irritated skin, the skin's integrity is not nearly what it should be. So that allows, for example, secondary bacterial infections to get a foothold. And it might be the innocent little bacteria that are on your skin normally, which when your skin is intact, they have no way of getting just inside the skin to cause problems. However, if that skin integrity has been disrupted, then they can get in and start causing issues. And that's often, yes, where the smell comes from. So the bacteria and the yeast on the skin. So to rule out any parasites like the mites, a skin scraper sometimes necessary, and I'll talk through the process of that with the clients as well. Doing a varying testing, so impression smears and the likes of that on the skin will tell you if it is a yeast, so the malassezia, or if it is in a bacterial condition. And sometimes you almost have to start chipping away at what you're seeing. So either medicated shampoos or systemic antibiotics, for example, to get what you're initially seeing under control and almost removing that from the equation and then seeing what you're kind of left with. So if the skin is still then inflamed and irritated, the likelihood of it having been the bacteria and the yeast that caused the problem is very, very remote. They would have taken advantage of the situation and compounded the problem, but once you get them under control, then you see what's left. Majority of the time with the allergic things, so we talk about atopic dermatitis. It's basically a diagnosis of exclusion as well. So that's where it can become incredibly frustrating. And when I say drawn out, it is a process that you have to go through.
And be patient.
And that's one of the first things I will then also discuss with the clients is it's not going to be a quick, easy fix. The likelihood of us getting a cure that your dog is never going to have this problem again is very remote as well. And that's where it becomes a management thing. So that's where the medicated shampoos come in. Like I say, the tick and flea, deworming, antibiotics. But then the longer term to keep that skin integrity intact that's the ultimate goal, is to stop the inflammation and then resulting in the secondary bacterial infections and the ear infections and the hot spots, et cetera, So that's where nutrition can play a part as well in dogs or cats that are not severely affected. I mean, all dogs and cats are going to scratch. It just becomes a question of like, okay, this is now excessive.
And it's causing trauma.
Absolutely. To the dog, emotional trauma to the owners because they're just seeing that this poor little thing is just consistently scratching. And then again, with the scratching resulting in secondary bacterial infection. So you can see how this whole vicious cycle can just carry on and on and on and on and on. And if that is the case where by ruling out all of those other conditions, you could potentially be left with this atopic dermatitis, and that's where the chronic management will then come in. So anything that you can do to keep the dog comfortable or cat, be it from a nutritional point of view, a supplementary point of view, and amazingly we have got there have been incredible breakthroughs with regards to non-cortisone based medications for longer term and indefinite use if necessary, which are, I would say, significantly safer to use long term than cortisone.
Okay, so let's go there. Why?
on cortisone. So in a nutshell, there's basically not an organ system in the body that is not going to be directly or indirectly affected by long-term cortisone use. So just going right back to the beginning when I said that cortisone certainly, I still feel, does have a place. Sometimes these poor dogs and cats they just need help. And the quickest, fastest, and very effective way of doing that is then to give them a cortisone dose. It doesn't have to be long. It's really just to break that itch cycle and just give them some sort of relief, and then potentially then get them onto a longer, more chronic thing. So I think if cortisone always gets a bad rap, and for good reasons, because when I say back in the day, these latest developments have only been available for sort of like the last 4 or 5 years here.
Absolutely, especially in South Africa.
Yeah, so we get a lot of, obviously it's nice that we can then get once medications and everything else are released in the United States and Europe, we might get them a good couple of years later, but then at least then we know from a safety point of view that they've had an extra 5-10 years of data capture and research and everything else on it to just prove that they are as safe as they claim to be. So cortisone back in the day was literally all that we had. And then we started getting the medicated shampoos and then the more specialized diets. And then the more research has gone into it, then you get the food additives. So if clients aren't able to afford, for example, a prescription skin diet, then there are various supplements that you can add to the food. And they'll generally be the omega-6 and 3 fatty acids, which also help with the skin integrity. So there are a whole host of different things. So if you can potentially stay away from cortisone, and if you're able to use one of the newer generation medications for chronic use, that's obviously first prize, and it is far safer and better than for the patient as well. The only thing, and I suppose that's across the board though, anything new and exciting and shiny on the market, unfortunately does have the price tag that goes along with it. But having said that, and in my experience of having used these medications, when you see the exponential improvement in the quality of life of your pet and yourself, even by not having to stress and worry, you can sleep the night through because they're not scratching and licking and all the rest of that.
And they're not on cortisone. They're not asking you to go to the toilet.
And they're not on
every 2
cortisone.
minutes.
That's exactly it.
Some of the side effects of the historical drugs.
Absolutely. So, yeah.
So let's talk side effects of cortisone, because what I hope to also do is what I've experienced a lot is, I had these leftover meds from my other dog. And the concern of using cortisone, not tapering the dose, using the wrong dose for the body weight, and not under sort of veterinary instruction in terms, and then having side effects, and in particular, they're not having the admission that they've been using that, and then coming into the practice and getting, say, an anti-inflammatory because they've hurt themselves, whatever. Yeah. So, cortisone absolutely, like you're saying, has its place. It's got to be carefully managed.
So the immediate yet reversible side effects of cortisone will tend to be an increased water intake, and then hence an increased urination, either volume-wise or frequency-wise. So that's on the label when we dispense cortisone, that it may increase water and then hence urinating. Ever so often then the appetite might increase, but it certainly doesn't mean you need to feed them anymore, even if they are really batting their eyelids at you, the little puppy dog eyes. Try not to give them extra. And then funny enough, one of our dogs, I always knew when I came home from university, for example, and dear Max was on cortisone, because you could just look at him down the passage and he would give you the hairy eyeball and start growling. So on the very, very, very rare occasion, they can become grumpy. But again, so all three of those, so the water intake increase, the urination increase, and food, those are the three most common ones that you're going to see. And if you do find that your dog becomes a little bit moody on it, it more than likely is because of the medication as well.
And then let's talk about interaction with other drugs.
So that's also what you have to be, and you just alluded to it now. So if we don't potentially know that the owner has been self-medicating their pet with leftover cortisone because they were itching, so we tend to stay away from using anti-inflammatories and then cortisone together. So it's either or. Otherwise, you potentially causing gastric issues, etc., etc. So I mean that can be a whole other discussion itself. So that's why it is always important. I mean, if you have given something, and that's something I'll always ask, if I'm going to be giving a cortisone or an anti-inflammatory, I'll ask, is your dog or cat on any other medication at the moment because of those interactions? So, also then, the long-term effects of cortisone, like I said, there's virtually no organ system that is not going to necessarily be affected. It can also result in metabolic or endocrine issues. So you do get Cushing's, which is the overproduction or stimulation of cortisol production in the body, which can also have skin-like signs as well. So hypothyroidism can also have skin signs. So it's not only environmental and fleas and the likes of that, it can also be then metabolic as well. So that's why, again, it becomes quite tricky to specifically pinpoint what's causing the issue. And again, if it is something like Cushing's, it's treatable. Hypothyroidism is treatable. So again, various medications available for something like that. So it's
important to try and get, even if it's a rule-out diagnosis, to work with your vet in order to try and establish what the underlying issue is.
And again, if you've been doing all sorts of weird and wonderful things, like, I mean, so most people, and it's the same, I think, in any household, that if there's something that you can do in-house before going to the vet, people would generally and unfortunately try and do that first. And then when they've exhausted those options, that's when they'll then come through to us, and then we can then talk them through the situation. So it's not always a good thing to try and sort stuff out yourself. Even if it's you just pop in and just have a chat with either the vet nurses or the animal health techs or the vets themselves, just to get some sort of ideas. Probably better that we work this one up and we see the patient.
Yeah. So before I lose the opportunity, because it just made me remember the old school. I don't know if it was when you qualified as well, and you'd come in and you'd see a dog shaved up and there'd be a panel and they'd be tested against various allergens. Do you remember those days?
Yeah.
I mean, testing is far less in terms of trying to establish an underlying cause, because mostly generally we're finding that there are multiple things going on. You might get something that is picked up, or it may not be something that they have a test for. I think that's probably where I'm wanting to go with this. But now there are really great drugs on the market that manage these cases better, that we're not doing that level of testing generally, are we?
No. So I think also, and I stand corrected here, but the success years ago when we used to do that, so yes, we used to send blood samples over, I think it was Switzerland, I think. And then they would test it against it. Gosh, you would get like a 7-page printout of all the plants that the dog was apparently allergic to. And I mean, anyone that's been to my practice, they know that I really love my garden. So I went and looked up some of these plants, and they're not even in South Africa. So it can be very misleading, and a lot of stuff that you have to still try and filter through to try and get it. And then they restricted the importing of almost like the desensitization that they would then formulate.
Like a vaccine.
So it just became a bit of more of a headache than anything else to try and actually then get. It was hellishly expensive. So I'm talking now sort of like 10, 11 years ago, it was expensive. So it is a possibility still now, but I would say that it'll probably tend to be more specialist workup for something like that.
Like you've tried everything, nothing's working, all the treatment, all the management protocols are just failing.
So they also, just to sort of like top off on that, is that there will potentially also be times, depending on what the skin lesions are looking like, that a skin biopsy can often be very, very helpful as well. So that's when we take, and it's not a huge amount that we take of the particular lesion, that then goes through to the pathologist, and then they then can see on a cellular level what's happening. And there are some really, really nasty skin conditions that are identifiable at a microscopic level. They might look the same externally, but on a microscopic level, very, very unique, and then you can then target the treatment and the management a lot more easily once you've then done that. So it's not something that I would necessarily do immediately, but if you get kind of like a little bit of an inkling that something's not looking great, a skin
best to
biopsy
get
is also
checked.
then the way to go as well. Yeah.
So in terms of you mentioned before about the common thing, people want to be able to try and home remedy and search how best to deal with various complaints. And you will get people trying over-the-counter request medication or want an ointment. Let's talk about what is available and what should be avoided. So, you spoke about shampoos. There are some really great shampoos on the market, but I often find people use them unless, when we're very clear with our instructions about the 10-minute contact time.
Yes.
And what. Can we go through some of the other things that people can be doing that maybe they haven't thought about? That they can attempt if they're really trying to just either short-term soothe or just add on top of the regime that their vet has suggested.
So often if the dogs are obviously really, 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 really itchy, then we would need to see them and go through everything we've just discussed previously. I sell to my clients as well, particularly with the shorter haired dogs, and you'll tend to find if it is something coming into contact with, sometimes the bordering of their lips, around their eyes, in the little armpits, on the tummy area, and then on the inside of the legs. So those tend to be more sparsely haired areas as well. And as we discussed, the hair can form a very, very good physical barrier.
Yeah.
If the dogs sleep indoors, I often just say just get a nice warm, damp face cloth when they come in for the evening and physically just give them a wipe down. So if there are any pollens or plant fibers, hair, grass hairs or anything like that, that can actually then physically remove that sort of thing. Humidity, you can't really do anything about. Yeah. If your dog is a swimmer, there are a host of ear cleansers, for example, that you can then give them a little squirt into both ears after they've been swimming, after they've come back from the parlor, for example. That will just help to clean and dry those ear canals out. And that can often be all you need for maintenance. As you've mentioned, the shampoos, so there are the medicated shampoos. There's a range of non-detergent shampoos, which are medicated, which I think are probably going to be the best ones to use because you're not then stripping the natural oils off the skin, but you are still having the beneficial effect of the active ingredients that are in there. And then, like you say, the contact time is important. So from an owner compliance point of view, I think us as vets can never assume that somebody, A, has listened, or B, knows how to use that product. So I will always go almost overboard in describing and discussing how to use the product properly. Because you can have a product that is the most amazing product, and if it's not used correctly, you're not going to get the benefit of it. And it is expensive.
So you want to get the benefit
Precisely
of it.
That. It might be that, again, the antibiotics, so I'm hoping that you're not using the antibiotics left over from Fifi's last little visit to the vet on your other dog. But again, we would be able to advise you for things like that. There are preparations that can be used on the skin topically. And again, I think the area that you use them in would depend on if obviously the dogs are going to lick them off or not. So that's the problem with ointments, is they can often just be removed, or one of our dogs, you put the stuff on and they would immediately go out into the garden or jump onto the couch and rub themselves. So you would get all of the ointment all over the furniture and nothing left on the dog. So I think it's also important that if you do have to go down that route, that is all taken into consideration as well. Like, are the dogs going to be left by themselves the whole day? Do they need shame? One of the cones of shame to stop them from scratching and itching or licking. It's
break the cycle.
It really is a multifactorial thing that you have to try and deal with.
And your opinion, I mean, even indoors, sorry, I had a scratch. All this itching has made me itchy. I often advise owners will regularly wash their pet's bedding. There's been a discussion about HEPA filters in the house for what it's worth. Not using their own shampoos because they've got a different pH to us.
Yeah. And that's what a lot of people don't realize. So even our physiology on our skin is very different to the dogs and cats as well.
Absolutely. And regular vacuuming, emptying the bags, or, so there are management strategies that people may not be aware of, just in terms of improving the environment, keeping your dogs inside for a bit when the lawn's just been cut. If you know that.
Funny enough, so we have found, I don't know if there has been any studies particularly on it, but generally freshly cut wet grass tends to be more reactive than just normal grass. Yeah. So if there's been a heavy dew fall after the grass has been mowed, rather just keep your little ones off the grass until it's dried.
Walk them on the pavement, obviously not
Yeah.
on the hot day. We've
No,
done the hot day one. But walk them on the pavement if
So
you
try
know
and
that
keep
they...
them off. I mean, you get little booties for them and everything else now
Yeah.
as well. So there's lots, little jackets, again, forming a physical barrier against
And also
things.
the UV light, preventing UV light and them...
Because those little white, anything white in the African sun is not a good combination. So,
absolutely. And then regular tick and flea treatment
Absolutely,
is obviously your
So the
mainstay in
parasite
terms of
control is,
top.
that's generally first and foremost, it'll be the first question that I'll ask is, are your parasites under control? And if not, that's the first thing that would then be addressed. And then you kind of go from there again.
Absolutely.
Yeah.
So take-home message as we've run out of time, because I know we could go and talk about this stuff all day.
forever.
Take-home message in terms of what's the best approach if your pet is scratching to the point where they've traumatized themselves. What do you advise?
They need to be seen for something like that. So you do get that horrible vicious cycle, and it just gets worse and worse and worse the longer it's left. So have you heard we call it elephant skin. So when you get that horrible or hyperpigmentation, so when it goes grey and wrinkly and dry, that just shows that it's been chronic irritation. It might not ever return back to normal, but we can certainly address the itch and that scratching and just get things settled down. So if it has gone to that sort of point, and if your dog or cat is keeping you up at night or even during the day, all you can hear is the scratch, they need to be seen so that we can intervene.
There are definitely things we can be doing.
But as you've also said, and I said right at the beginning as well, it's a process. It can be very frustrating for all three parties involved. It's just a patience thing, and you do have to work through it. But the likelihood of it being cured is remote. It's not impossible, depending on what it is, but it does become a management process.
Absolutely.
So,
Thank you once
Thank
again
you.
for taking time out of your very busy schedule. I know you've been
Thank you.
consulting this morning, so
Yes.
thank you for your time.
I appreciate
and
coming
your
through.
expertise on this subject.
Thank
It's
you.
been really informative.
Thank you.
Dr. Nic Ster.
Thank you.
Thank you so much for tuning into today's episode on the Pause and Effect podcast. If you found the discussion helpful, please like, share, and follow our podcasts. Don't forget to leave us a comment or review. We love hearing from our listeners. Remember, you can listen to us on your preferred podcast platform.
We have an exciting announcement to make. We are looking for guest speakers who are passionate about the pet industry and sponsors to support future episodes. Are you an expert in pet training, nutrition, or behavior? Maybe you're a veterinarian with insights to share, a pet store owner with unique experiences, or a pet product inventor. We want to hear from you. The Pause and Effect podcast is a platform for industry professionals like you to showcase your knowledge, experiences, and stories. As a guest speaker on our podcast, you'll have the opportunity to share valuable information, engage with our audience, and have your voice heard in the pet community. Whether you want to discuss training techniques, emerging pet care trends, or the importance of mental stimulation for pets, we want to feature you and your expertise. So, if you're passionate about pets and have something to say, we invite you to join us on an upcoming episode of the Pause and Effect podcast. But wait, that's not all. The Pause and Effect podcast is also seeking sponsors to support our mission of educating and entertaining pet lovers worldwide. By becoming a sponsor, you'll gain exposure to our engaged audience and have your brand associated with the love and care that we have for our four-legged friends. If you own a pet-related business, offer pet products or services, or simply want to align your brand with our pet-loving community, we'd love to partner with you. As a sponsor, your brand will be featured prominently in our episodes and our social media channels. It is a great opportunity to showcase your offerings to a dedicated audience of pet enthusiasts. So whether you're an expert in the pet industry looking to share your knowledge, or a business seeking to reach a pet-loving audience, we want to hear from you. To apply as a guest or to inquire about becoming a sponsor of the Pause and Effect podcast, please contact me at Dr Carra at pauseandeffect.co.za. Get in touch and let's discuss the various opportunities. Thank you for joining us today. We can't wait to welcome our future guest speakers and sponsors to the Pause and Effect podcast. Remember, every episode is an opportunity to celebrate our four-legged friends.